Hello, I'm Zita West and I want to tell you what happens when you come for IVF at this clinic. What we really do well here is the whole integrated and holistic approach. We do the medical side, but also this is what couples want. They want to look at their diet, their nutrition, their lifestyle, their stresses. They want a plan of action in order to prepare for IVF and also to have support when they're going through IVF. So let's go meet one of our nurses. So this is Sophie, one of our nurses. So for the first time a couple come, how are they feeling and what do you do at that first consultation?
The first consultation is an opportunity for patients to ask questions, basically.
And what are the sort of common fears or worries that couples will have IVF?
I would say the most common fear and worry is logistically how they're going to manage this with their day-to-day life. So work commitments, people are often worried about, and we see people from all over England, abroad, so often it's how am I going to book my flights, when should I book them, you know, should I book train tickets in advance, that kind of thing. If I'm going to have annual leave, when's the best time to have it? So the whole point of this consultation really is about confidence building and reassuring patients about what's ahead of them. I think we're a very supportive clinic and it's the first, I guess, opportunity people get to talk through these kind of things, and you build up a relationship with people from the get-go, so you've got someone there that they can talk to from then on. Also in the first nurse consultation we'll talk through the complementary therapies, which are obviously a really important part of our clinic. So we will talk through make sure they've had a nutritional lifestyle assessment, we'll talk through the counselling available, hypnotherapy and acupuncture, and the timings around this and what they're used for and why. So
Sophie, before they start IVF, there's a second consultation with you. What happens in that consultation?
At that consultation we'll need both partners to come in and we'll talk through your consent forms. There's a lot of admin.
Oh God, that's a lot, isn't it?
You can imagine being a bit shocked when you receive that via email. So we basically go through page by page and make sure you understand what you're signing, make sure we answer any questions that you've got. We would then teach the patients how to self-inject at home using our demos. We've got a drug box down here, so we'd talk these through with the patients and show them exactly how to inject. These are some of the drugs that our patients will be using, so they'll be sent them out in the post, and at the second nurse consultation we'll basically teach them how to use the equipment and what they need to do.
And are they nervous? It must be quite scary doing an injection for the first time.
But some people aren't nervous and some people are, but I think when people actually see the drugs that they're using, they're often reassured that the needles aren't as big as they think they're going to be.
I'm just interested, do the men give many injections?
Many of the men do, but I think it's good for the woman to know as well, so if he's out for one night, for example, they're not panicking.
But what's the most important thing you have to do when you're doing these injections? You know, in terms of they're done at different times, people are busy.
Yes. I think in the world that we live in, people are so busy, their social life, work life, and this is an added stress in their life. So I think you need to be super organised, and I think a good thing to do would be in your diary, tick off, or on your protocol that you'll receive, tick off when you've given yourself the drug, because you may well forget. We often get calls from people saying, I'm not sure if I've taken that drug this morning, should I take it again? Try and prevent that happening. Just simply tick right next to the word on your protocol, the medication that's there, and then you know that you've had it.
So Sophie, what is the best part of the job for you?
I would say having a positive result for anyone really. I still get that feeling every time I give someone a positive result. It's a real pleasure to be part of, and I feel genuinely really privileged to be in that position to give someone a positive result, and being in pregnancy scans is still just so lovely and so wonderful, because people have been through so much to get to that point, and it's just lovely to be part of it.
I hope this gives you a glimpse of how we do IVF in the clinic, and if you want an appointment, please phone reception on 0207 224 0017 or visit our website. Thank you very much.